At West Valley Hearing Center, our primary goal is to make sure that our patients are happy, satisfied, are hearing better, are not dizzy anymore. We've taken care of their ringing in the ears or tinnitus. The foundation for us has to be best practices, and we're always looking for the best patient outcomes that we can get for every patient. What makes us unique is that we have 3 doctors who have gone through a lot of education, have gone through a lot of training, continuing education, but education alone does not equate to patient satisfaction. Continuing education not only locally, but also nationally and even internationally to learn new techniques and new processes that we can provide to our patients. And that's what really makes us unique. At West Valley Hearing Center, we provide a plethora of services. Not only do we focus on hearing testing and hearing aids when patients need hearing aids, but we also provide a comprehensive tinnitus solution for our patients. Patients who have ringing or buzzing in their ears will come to us, we'll do a full diagnostic evaluation, a tinnitus evaluation, and then we provide the appropriate solution, whether that's using cognitive behavioral therapy or using sound therapy. We also provide a lot of balance testing, which is called the vestibular system in our ears. So if a patient has vertigo or balance disorders, we are one of the highest rated clinics to send patients to so that we can take care of their needs. On top of that, some patients don't need hearing aids, and we go a little bit further beyond into what's called cochlear implants. Now, not everybody is a candidate for cochlear implants, so we want to make sure if somebody is a candidate for cochlear implants that we've gone through the process and we make sure that that's the right solution. And finally, we look at oral rehabilitation. Now, what oral rehabilitation is like physical therapy for our hearing. So if you can imagine, if somebody has broken their leg, yes, we take care of the leg, but then you go through some physical therapy. So we see a lot of patients who get referred by their primary care physicians or otolaryngologists, which are commonly known as ear, nose, and throat physicians. And a lot of them come in worrying that we're going to be a sales place and really push hard on selling hearing aids. And that's absolutely not true in our office. In fact, nobody here is on a commission or a bonus structure where everything is based off of hearing aid sales. What we really focus on is the patient outcome. So when a patient comes in and we've done their hearing evaluation, if the recommendation is hearing aids, one thing that we do is we provide a consultation to our patients to make sure that our patients have made the best educated decision on what's the right solution for them. Now, sometimes what the patient wants and what the recommendation is doesn't always line up. Well, when that happens, it's our job to make sure we explain that to our patients. Now, if somebody does move forward with hearing devices, we follow a very comprehensive protocol, which includes a full 1-hour fitting, verification testing, programming, counseling. Then we see our patients a week later. That's a 1-week follow-up. And then we'll see them a couple weeks after that, and maybe a couple weeks after that, maybe a couple. We'll keep going until our patient is doing well. Now, in the first 2.5 months, if we're running into trouble, we can always try a different solution, or we can just wipe the slate clean. Our priority is our patients, and so we'll do whatever it takes to make sure our patients are happy. One of the neat things about the profession of audiology is it's not a transactional relationship where we see you once and we never see you again. Generally speaking, we end up building a very long-term relationship with our patients, and we do that on purpose. Number one, every 4 to 6 months, we see our patients for routine checkups, which generally are either included or we bill your insurance for those visits. Every 6 months, our patients come in, we see them, we talk to them. We end up learning a lot about our patients' lives and their families and their friends and what they're doing in the community and the environments. The reality is that we focus so much on our patients that we build this lifelong relationship with our patients. We have 3 doctors and we have 2 team members up front. Because it's a small team, it's almost like we're a small family. The culture here is of providing the best services for our patients. I've seen thousands of patients in my career, and one story stands out to me. And it was a younger lady who had tried numerous hearing aids in different places around town, and she'd spent so much money looking for that right solution. And so when I first saw her, we did her hearing evaluation. There was nothing extraordinary about her hearing test results. And so the idea is that when I started talking to her, I said, well, let's look at what you have. And sure, the hearing aids that she had were pretty good. So the first one we tried to work with, which were very top of the line hearing aids, what I decided to do instead of trying to get her to buy new hearing aids was to adjust her current hearing aids that she had. and she had spent thousands of dollars on these hearing aids, much more than maybe she should have. We were able to program those hearing aids, do some verifications, and sure enough, we found out that one of the hearing aids was not actually functioning 100%. So we sent the hearing aid off to get repaired. It came back. We followed the same protocol we do with every patient, got the devices set up for her. Within a year, she came back in and said, you know what, I'm so happy. I can hear everything. I got my job back. She had lost her job. That's part of our culture, is to make sure it doesn't mean that you have to buy hearing aids from us. What it means is that we provided a solution to that patient, and now her quality of life is completely improved. So many audiology offices like ours focus on patient outcomes. And we have a very traditional sense of making sure our patients do very well. So yes, even though it feels very homely when our patients come in to see us, be rest assured that we are continuously learning about new technologies, new techniques, new protocols, because the end result is technology is always improving, ever changing. And so our job is to learn about the technology and apply that to our patients. Now, we're not a clinic that's going to send out letters every year saying, hey, there's this shiny new hearing aid out there. However, when these technology leaps occur, it is our job to make sure that we provide that information to our patients. How do we balance both? It's exactly that. We look at the new technology, we decide which patients need new technology, or we take this new protocol or procedure and we apply it to every single patient. So growing up, my father was a cardiologist. My brother is a physician. My cousins are physicians. I grew up around healthcare and medicine. And I'm very proud of how our clinic treats our patients. We focus very hard on making sure we provide ethical and effective treatment solutions to every patient. And I think you can see it from the front office all the way to the doctors in our clinic.